Hello, everyone, and welcome back. If you've ever tried to do everything right for your gut, eat more fiber, add the chia seeds, push the veggies, and somehow felt worse instead of better, this episode is for you. I see this all the time. Somebody is in the middle of a flare, their digestion feels unpredictable, maybe urgent or uncomfortable, and the advice they keep hearing is just eat more fiber. And instead of helping, it feels like it makes everything harder. More bloating, more urgency, more second guessing every meal. So, today I want to talk about when lowering fiber can actually be the more supportive move. Not forever, not as a rule, but as a short term way to help the gut calm down and feel more predictable again. We'll walk through when a low fiber approach can make sense, what kinds of foods are usually better tolerated during that phase, and how to think about rebuilding fiber later without setting yourself back. So, if fiber has felt confusing, frustrating, or like something you're constantly getting wrong, this conversation should bring you a little more clarity. Let's start by talking about what a low fiber diet actually means. When we talk about a low fiber diet, we're really just talking about temporarily choosing foods that are easier for your gut to handle. Fiber adds bulk to the stool and it increases stimulation in the digestive tract, which is great when your gut is calm and functioning well. But when things are irritated, inflamed, or sensitive, that same bulk and stimulation can feel like too much and actually worsen symptoms instead of helping. Lowering fiber for a period of time can reduce the bulk to your stool and it reduces digestive workload, giving the gut a chance to settle, especially when larger, bulkier stools or more frequent bowel movements are part of what's triggering discomfort. That doesn't mean you're eating poorly or missing out on nourishment. A low fiber approach can still include adequate protein, calories, fats, and micronutrients when it's done intentionally, even though it may look different from how people usually think about a healthy diet. It's also worth clearing up a common point of confusion. Low fiber and the low residue diet are related concepts and are sometimes used in similar clinical situations, but they're not exactly interchangeable. Low residue is typically used as a more medical term and generally refers to minimizing undigested materials in the stool, while low fiber is a broader, more practical way of reducing bulk and stimulation. So, for the purpose of today's episode, we're going to stay focused on low fiber as a short term tool, not a permanent or disease specific plan. So, what situations would low fiber be helpful? There are certain situations where temporarily lowering your fiber intake tends to be more helpful than continuing to push fiber. And this is something we recognize through patterns we see with clients every day. Rather than being about a specific diagnosis, it's about how the gut is responding in that moment and whether adding bulk and stimulation are helping or making things harder. So let's talk about what types of situations would temporarily lowering your fiber intake be useful. So the first one is during active symptoms. So especially diarrhea, urgency, cramping, pain, or when adding bulk and fiber tends to make the discomfort worse. Another time would be after surgery or procedures when your digestion feels really sensitive and simpler foods are better tolerated. We may also lower fiber when larger or bulkier stools are creating pressure, pain, or a sense of irritation rather than relief, or when repeatedly increasing fiber leads to heavy, unsettled, or a backed up feeling instead of smoother digestion. One of the clients I'm thinking about, she had a long history of digestive issues, but she was recently having a stretch of worsening urgency and loose stools, and it was starting to feel unmanageable. She told me that mornings felt like a gamble. She'd wake up extra early to see how her gut was going to behave before deciding whether she could even go to work. In that case, we said, okay, let's take a step back and We advised her to follow a low fiber approach. She had even stopped eating breakfast because she was worried it would trigger another urgent trip to the bathroom. I know some of you listening can relate to these things because a lot of us do this when we're experiencing urgent symptoms. We plan our day around our symptoms, we skip meals to try to control the symptoms. And she was constantly anxious about having an accident or needing to call in sick. So, we advised her to follow the low fiber approach for just a few weeks to help calm things down. And that meant pulling back on bulkier foods and shifting towards simpler meals. So things like eggs with white toast in the morning, rice with chicken or fish for lunch, and well cooked vegetables in smaller portions instead of like raw salads. Within a couple of weeks, we were able to calm her bowel movements down. They became less frequent, more formed, and far more predictable, which made a huge difference in basically how safe she felt to eat. And then once her symptoms settled and that constant anxiety eased, we had a good baseline then and starting point. And from there, we could begin rebuilding fiber slowly and intentionally layering foods back in a way that supported her overall gut health and resilience instead of sending her right back into another flare. So let's talk a little bit more about the nitty gritty. What are some of the foods commonly recommended on a low fiber diet? When we talk about the low fiber diet and the foods that are commonly included, the focus is not to be really rigid and black and white with this. So we don't want to think of this as a list of really rigid low fiber foods or labeling things as universally safe or unsafe. It's really more about choosing options that are gentler on the digestive tract in general, especially in terms of texture, preparation, and portion size. How a food is cooked and how much of it you eat often matters just as much as the food itself during this phase. This usually means leaning on refined grains and starches that digest more easily, like white rice, white bread, or plain pasta. Proteins tend to be better tolerated when they're tender and simply prepared. So we're talking about things like eggs, fish, chicken, turkey, tofu, without heavy coatings or added roughage. Low fiber fruits and vegetables can still have a place, but they're typically better tolerated when they're well cooked and eaten in smaller amounts rather than raw and fibrous. Many people find that vegetables low in fiber, such as well-cooked zucchini or peeled squash, and low fiber fruits without skins or seeds feel gentler during this phase. Fats are included in ways that add calories and satisfaction without adding bulk to the stool. So we're thinking more in terms of oil and butter rather than nuts, seeds, and high fiber fat sources. The goal here is not perfection and it's not restriction. It's choosing foods that allow digestion to feel calmer and more predictable while your symptoms settle so that eating doesn't feel like a constant experiment. So, what are some of the foods that we do want to limit or avoid temporarily in this phase? The foods that tend to be limited or avoided are usually the ones that add the most bulk or mechanical work for the gut. These are foods that are perfectly healthy in other contexts, but can be harder to tolerate when digestion is irritated or sensitive. This commonly includes raw vegetables and salads, foods with skins or seeds, and tougher plant fibers that don't break down easily. Larger portions of legumes, whole grains, bran, and nuts and seeds also tend to increase stool volume and can worsen urgency, discomfort, or unpredictability during this phase. The key thing to remember is that these foods are not bad and they aren't being avoided forever. They're simply harder to digest during certain phases, which is why they're usually the first foods we reintroduce slowly once symptoms settle. So I always think of this in terms of when your digestive system is irritated, think of your intestines as they're irritated, they're inflamed. So it's like if you had a rug burn on your skin. So if we eat a lot of fiber, that passes back and it grates on that already sensitive area. So we want to keep it non-fibrous, keep it gentle so that we're not further irritating, and that allows the inflammation and the irritation to heal. How long do we want to continue the low fiber diet? A low fiber diet is typically used as a short-term tool. And in most cases, the goal is to give the gut a window to calm down, reduce stool volume, and regain predictability before moving on. We usually look for signs like more formed bowel movements, fewer urgent trips to the bathroom, less irritation during and between bowel movements, and a general sense that digestion feels steadier before even thinking about adding fiber back in. Reintroducing fiber is not about flipping a switch or suddenly returning to a high fiber diet. It's a gradual process that focuses on small increases, cooked and softer sources first, often starting with fruits and vegetables low in fiber, and enough time between changes to see how the body responds. And this is the same step-by-step approach we use when we're rebuilding fiber tolerance, and it's what helps expand the diet without triggering another setback. One of our clients who stands out, Emily, she was following a low fiber approach for about 4 weeks while things settled down for her. And when it was time to reintroduce fiber, she was nervous. She kept asking, what if this puts me right back to where I started? So we didn't want to jump back into raw vegetables or whole grains. We started with just a few forkfuls of well-cooked zucchini at dinner and kept everything else the same for several days. And we waited. Nothing happened, which was the point. After that, we added peeled pear. It was cooked or very ripe. We gave her those two options in small portions. And then we gradually increased her cooked vegetables. And she said the biggest shift was not just her digestion, it was just her confidence. By easing in slowly like that, she stopped bracing herself for symptoms after every meal because she understood the plan. She knew we were making small, careful changes, and she knew nothing major was going to set her off. And over time, that structure, we continued along with that structure, and that allowed her diet to expand without fear. And so she didn't have to stay on low fiber, but she also wasn't gambling with her gut. And that's what made rebuilding tolerance actually work for her. This is also where I see people get really overwhelmed because when symptoms are active, even basic food decisions start to feel very heavy. What do I eat for breakfast? What do I buy at the store? What's going to make things worse? And when you start Googling, the advice is all over the place. One list says a food is fine, the other list says to avoid it, and suddenly you're second guessing everything. So I did create a simple food list and a short meal plan to help support you in this phase. And we're going to link to that in the show notes if you want something concrete that you can go by and reference. So just as a final note here, fiber does play an important role in long-term gut health, and that's why I've repeated so many times throughout this conversation that this should not be a long-term approach. Fiber is so important for your long-term gut health, and following a low fiber approach for a little while does not change that. We're just acknowledging that there are times when the gut needs support and stability before it's ready for more stimulation. And so timing matters, tolerance matters, and what works well for the gut later on may not be appropriate in the middle of a flare or recovery phase. The bigger picture here is personalization. Gut health is not about forcing the body into a one-size-fits-all plan, but about meeting it where it is and adjusting as things change. So if you're in a season where low fiber feels better, that does not mean you're doing anything wrong. It means you're listening. And with the right support and step-by-step approach, most people are able to move forward from this phase and rebuild flexibility with food over time. That process does not have to be rushed and it does not have to be perfect to be effective. So thank you guys for listening today. Definitely check out that low fiber food list and meal plan in the show notes, and we will see you next week.